Let's talk about the changes that have been introduced in DSM-5 TR. TR is text revision. Okay, so what changes have been introduced? We can group them into these categories. Number one, what categories, what diagnostic entities have been added? Diagnostic entities that have been added. These are three: prolonged grief disorder, unspecified mood disorder, stimulant induced, mild neurocognitive disorder. Right? The three diagnostic categories have been added in your DSM-5 TR. Now, what these are, let's just have a quick look. Number one, prolonged grief disorder. So, what is the prolonged grief disorder? It is told that the following symptoms should be present for at least 12 months following the death of some loved one. What symptoms? Intense yearning of the deceased, persistent preoccupation with thoughts, persistent preoccupation with thoughts of deceased, and signs and symptoms of grief such as emotional pain, emotional numbness, and avoidance of reminders of deceased. And these should be severe enough to cause dysfunction in daily life. Okay, so one is prolonged grief disorder, 12-month symptom for after the death of loved one in the form of intense yearning, preoccupation with thoughts, emotional pain, numbness, and avoidance of reminders. Right, this is one. Then second entity that has been added is unspecified mood disorder. Unspecified mood disorder are the one when the symptoms are such that they cannot fit in any of the category of bipolar or depressive disorder, not even in their unspecified forms. Right? Unspecified bipolar disorder, unspecified depressive disorder. Right? The symptoms are not such that any of these four categories are fulfilled. And what is the example of unspecified mood disorder? For example, acute agitation. Okay, this is the second category. Then the third diagnostic category that has been added is stimulant induced mild neurocognitive disorder. Right? What is stimulant induced mild neurocognitive disorder? When there has started impairment in neuropsychological functioning. For example, difficulty in learning, memory, or executive function because of the substance used, right? Stimulant induced mild neurocognitive disorder, right? So the first category, first grouping of the change is adding of the diagnostic entities. These are prolonged grief, unspecified mood disorder, and stimulant induced mood disorder. What is the second category of change? The second grouping can be divided into changes in criteria or course specifiers. These have been number one in autism, criteria A, in adjustment disorder, in the course specifier of mania, and in delirium. right? The changes in the criteria or core specifier have been very, but the most important for us are these four. Now, what changes are there? Let's see. What changes have been included in autism? So, in autism, in criteria A, it was defined as criteria A was difficulties, difficulties in social use of verbal and non-verbal communication. Okay, so criteria A was persistent difficulties in social use or verbal and non-verbal communication. What was written in DSM-5? It was written further that as manifested by following. It was there in DSM-5. Okay, and there were 3 pointers, right? So it was inferred that these 3 pointers could be taken as either one of the 3 or 3 out of 3 should be present, right? So this was the ambiguity in DSM-5, and now this has been changed to, the wording has been changed to persistent difficulties in social use of verbal and non-verbal communication as manifested by all of the following, implying that 3 out of the 3 should be present, right? So in autism criteria A, this is the change, right? Verbal and non-verbal communication as manifested by following has become more clear as, and as manifested by all of the following. Then the second change is there in the mania course specifier mild. What was there in DSM-5? DSM-5, it was told that the what was told for mild symptom? Few, if any, symptom in excess of required threshold, distressing but manageable, resulting in minor impairment, resulting in minor impairment. Okay, so for mild, it was told that there should be minor impairment in the functioning in DSM-5, but it was in contradiction with the criteria C. Criteria C of mania, which states that the significant dysfunction should be there. Significant dysfunction requiring socio-occupational dysfunction or requiring hospitalization or psychotic symptoms, right? So it was in contradiction. Now, what has been done in DSM-5 TR, the course specifier of mild, moderate, and severe has been actually been now the same which were there in DSM-4. What it is being told that mild are when minimum symptoms criteria are met, minimum symptom criteria met, moderate when significant increase in activity or impairment in judgment, significant increase in activity or impairment in judgment, and severe when continuous supervision is required. Okay, so the course specifiers of mild in Mania was in contradiction with criteria C. So these are now the force specifiers, right? And what is the third change? In adjustment disorder, the duration has been specified for acute when the symptoms are present for less than 6 months and persistent when the symptoms are present for more than 6 months. More than or equal to 6 months, right? Adjustment disorder for acute and persistent, the symptom duration has been specified. And what regarding delirium? So, what was there in delirium? Again, in delirium, criteria A was, okay, decreased ability to direct, focus, sustain, and shift attention. Decrease ability to direct, focus, sustain, and shift attention. That was okay. But what was there was, along with, it was told a decrease ability to direct, focus, sustain, and shift attention, and reduced orientation to environment. Reduced orientation to environment was the same as criteria C, which was telling कि disorientation, criteria C, which was telling disturbances in cognitive function. Right. And we know the higher cognitive function disorientation is orientation is one of the part of cognitive function, right? So kind of criteria A and C were common, overlapping, right? Criteria A, decrease in direct focus, sustain, and shift attention, and reduced orientation to environment, which was, this part was overlapping with the criteria C, right? It was there in DSM-5. Now, what has been changed in DSM-5 TR? The orientation part has been removed. And now it states that the new criteria A for delirium is disturbances in attention along with decreased awareness of environment. Okay, so the word orientation has been changed with the awareness, right? So because orientation was coming in criteria C also, higher cognitive function, orientation is one of the cognitive function. Now it has been changed to decrease awareness of the environment, right? So these are the 4 changes in the criteria or core specifiers, right? That in autism criteria A, it has been told that all of the 3 criteria, subtypes of the criteria A should be present. All of the following should be present. In adjustment disorder, duration for acute and persistence has been described. In course of specifier of mania, mild, moderate, and severe has been taken to what were there in DSM-4 because minor dysfunction was in contradiction with the minor dysfunction in mild mania was in contradiction with the criteria C of mania, which states that severe dysfunction should be there, right? So now mild, moderate, severe categories have been defined as per what were there in DSM-4. And in delirium, again, criteria A has been defined as orientation. In criteria A now has been changed to awareness, right? Because the word orientation was overlapping again with the criteria C of delirium with the disturbed higher cognitive function, right? Okay, so the 2 categories, one is the diagnostic entities added, 2 is changes in criteria or core specifier, And the third change which has been there is some terminologies have been updated. For example, neurolept medication, has been changed to antipsychotic medication. Because neurolept was more of like implying side effects, right? It was emphasizing more of side effects, right? Then one is neurolept medication, intellectual disability, like signifying more of disability, it has been changed to intellectual developmental disorder. Conversion disorder has been changed to functional neurological syndrome. Then desired gender, these are mainly result concerning with gender dysphoria. DSIRED, desired gender has been replaced with experienced gender. Then the terminologies natal male or natal female has been replaced with in DSM-5 TR with individual assigned male or female at birth. Right. So now less of the stigma related terms have been used, right? So the terminologies updated are neurolept medication is now antipsychotic medication, intellectual disability with intellectual developmental disorder, conversion disorder with functional neurological syndrome, desired gender with experienced gender, and natal male or natal female with individual assigned male or female at birth. Right. So these are the main changes that have been defined in our DSM-5 TR. Okay. Adding of diagnostic entities, changing the criteria or core specifier and terminologies added. Right. Now just a very short quick review. Changes in DSM-5 TR. Okay. Before we go quickly, I hope we all are okay that DSM-1 was written as this, 2, 3 till 4 it was written as this, but DSM-5 is written like this, 5. Why it is written as this and not as 5? Because from now on, whatever revisions will be there, they will be in the form of 5.1, 5.2, 5.3, and there will be no 6, right? That's why this Arabic numeral system was adopted over Roman numerals at DSM-5. Right. Now, what are the changes in DSM-5 TR? A quick revision into 3 categories, adding of the diagnostic entities, right? Changing in the course or criteria, course specifiers or criteria, and terminology change. Diagnostic entities that have been added are prolonged grief, uh, the changes, one is prolonged grief, unspecified mood disorder, stimulant induced mild neurocognitive disorder. Changes in course specifier have been there for autism criteria A when all three are required. Have regarding adjustment disorder, the duration has been described. Regarding delirium, the orientation in criteria A was overlapping with the criteria C of higher cognitive functions. So orientation word has been changed with decreased awareness of the surroundings. And and regarding the mania course specifiers of mild, moderate, and severe intensity, how they have been changed, right? And in terminology, finally, the terminology has been changed for neurolep medication will be now antipsychotic medication. With the conversion disorder will be functional neurological syndrome. The gender dysphoria related terms have been uh, changed, right? And one more thing was there, intellectual disability will now be intellectual developmental disorder, right? One more thing is there, that in the text revision now, one more thing, that the fourth criteria, the fourth grouping that can be added is changes in DSM-5 TR is the addition in the text of mainly two things regarding sex and gender related diagnostic features have been added with the disorders, and association with suicidal thoughts and behaviors. Okay, so basically the changes in DSM-5 into these four groups. Adding diagnostic entities, changes course criteria, course specifier or criteria, terminology change, and addition in the text for sex and gender related diagnostic features and association with the suicidal thoughts. Right? These are the changes that have been described in our DSM-5 TR. Thank you guys. For any clarification, please contact at happy reading. Thanks, guys.